Hello, I am Dr. Abdullah from Dr HE Clinic. We are performing weight loss surgeries, as you know. Today, I want to speak about a novel procedure, endosleeve surgery. Endosleeve surgery is a novel endobariatric procedure in which we imbricate the greater curvature of the stomach by stitches. There is a word in this sentence, surgery, but especially this is not a surgery. It's an endoscopic intervention that we perform for weight loss. In endosleeve surgery, we are using a device called Apollo, and by this device, we are putting inside stitches to the stomach wall. We start from the downside of the stomach, from antrum side, and we go through the cardia side, and at the end of this procedure, almost 50% of the stomach is out of order according to the imbricated condition. But we want to say that this is not same with gastric sleeve. In our practice, after gastric sleeve surgery, patients almost lose around 30 to 40% of their initial weight. But after endosleeve surgery, this rate is around 10 to 20%. This means that the weight loss is less than gastric sleeve with endosleeve. For that reason, especially we recommend this procedure for the patients in class 1 obesity. It means the BMI between 30 to 35. But we can do this procedure also to the patients with high BMI if they don't want to have a surgical approach for weight loss. But they should know that the target is not same with gastric sleeve in endosleeve surgery. The procedure time in endosleeve surgery differs from clinics to clinics because it's about the experience. Sometimes in the beginning, the procedure time may go 4 to 5 hours, but in experienced clinics, it's around 1 to 2 hours. Also, it is asked to us that what about the recovery after endosleeve procedure? It is faster than gastric sleeve. Sometimes the same day discharge is possible, but in routine practice, the patients can be discharged after the day of the procedure. If it is needed to speak about the advantages of endosleeve surgery, first is less invasive. This is a less invasive approach because there is no incision, there is no staples, there is no resection. We only put stitches inside. Another advantage of endosleeve can be said as a speed recovery according to the minimal invasive condition of this procedure. And the disadvantages can be said as the weight loss is less than the surgical methods, and sometimes the stitches inside may be opened and another procedure may be needed, but the rate of this is very less. And also, nutrition periods after endosleeve surgery is similar with gastric sleeve surgery. We recommend our patients to start their nutrition with liquid diet, maybe for first week, and 1 week more for pure diet. And after 2 or 3 weeks, they can go on normal food intake. And sometimes we have also questions from our patients that may I prefer to have endosleeve surgery instead of gastric sleeve surgery? Especially the patients who have BMI over 40, we don't recommend in our routine to have endosleeve instead of gastric sleeve. Only the patients with some risks about the surgical approach may attend endosleeve surgery. But with high BMI, all the literature suggests that weight loss is higher in surgical approach as gastric sleeve, gastric bypass than endosleeve surgery. As a conclusion, you will always hear new concepts on bariatric surgery. You should know that experience is very important. So while choosing a clinic, please search everything, instruments and the team and the experience. I wish a healthy life for all our patients.